Let's jump right in. We usually think of AI as this answer machine, right? You ask a question, it gives you an answer. But what if its real superpower isn't about the what, but about the how? Today, we're going to look at a completely different model for learning complex skills. It's not about a simple Q&A. It's about having a dedicated mentor right there on your screen.
I mean, think about it. How does anyone really make that leap from apprentice to master? It's this age-old puzzle. You can have your head crammed with textbook knowledge, but then you step into the real world, the pressure's on, and there's this massive gap. Knowing the facts is one thing, but knowing what to do with them? Well, that's the whole ballgame. And this is where we meet our guide, Marcus. He's a fourth-year vet student, super bright, knows his books inside and out. But right now, he's just staring at a patient's x-ray, and he's stuck. His professor has this great name for it, intelligent uncertainty. You know, that feeling where you know all the pieces, but you just can't quite see how they fit. The confidence just isn't there yet.
And you can just hear it in his own words, can't you? That's the heart of the problem. It's that frustrating, anxious feeling of having all the puzzle pieces right in front of you, but no idea where to even start. This is that exact moment where learning can just grind to a halt, and that little voice of self-doubt starts getting really, really loud.
So instead of just spoon-feeding Marcus the answer, his professor introduces him to something totally new, an AI tool called BELFI65. But here's the key part. It's not a diagnostic crutch. It's not a shortcut. It's designed to be a digital mentor, built specifically to help him cross that confidence gap.
Okay, so here's the challenge. Marcus is faced with Max, an 8-year-old golden retriever. Poor guy's got a cough that's just getting worse and he's really struggling to breathe. So Marcus does what he's supposed to do. He uploads all the case info, the x-rays, the blood work, the whole patient history right into the system. And this is where the magic happens. BELFI65 doesn't just spit out a single diagnosis. No way. It lays out 3 different specialist perspectives side by side. It's like having a whole panel of experts in the room. The radiologist breaks down the x-ray, pointing out why certain signs confirm the location of the problem. The internist connects the symptoms to the history, telling a coherent story. And the pathologist explains what the blood work actually means in this context. It's a total masterclass in how to think like an expert.
And for Marcus, this is the big aha moment. It's huge. He's seen all these terms in his textbooks before, of course, but this is the first time he's seen how the pros use them to systematically rule things out and build a case until they land on a conclusion they can really stand behind. He's not just being told the answer, he's being taught the process. And that's the game changer.
So that's great in theory, but does this new way of learning actually stick? Let's see what happens when we move out of the controlled classroom environment and into the chaos of the real world. Okay, fast forward 6 months. Marcus is a new grad. It's 11 p.m. on a Saturday night in a tiny rural clinic. A boxer is rushed in, barely breathing, pale gums, swollen abdomen. It's bad, and there's no senior vet to call for backup. This is the ultimate test. 6 months ago, this situation would have been absolutely terrifying.
But watch him now. He's calm. He's systematic. He immediately stabilizes the patient. He uses BELFI65 not because he's lost, but to confirm his suspicions and to quickly absorb the reasoning from 3 different emergency perspectives. Then he walks out, clearly explains the plan to the owner, and with total confidence, he performs the life-saving surgery. See, he didn't just follow a checklist. He was embodying that expert mindset he'd been practicing.
Now, that story is incredibly powerful. But is it just a fluke? Let's take a look at the actual data behind this kind of professional growth.
This chart really tells the story of what was happening inside his head. In just 1 year, Marcus's self-reported confidence level doubled, from a hesitant 4 out of 10 to a solid 8. This isn't just about getting cases right. It's about that deep feeling of being capable and in control.
But the system also acts like a kind of personal career coach. It's tracking his progress. It sees that in 43 of his cases, he actually modified the protocols. That shows he's developing his own independent judgment. It even identifies his strengths, like internal medicine, and then gives him a nudge, suggesting he focus on areas like cardiology next. It's a personalized development plan that grows right along with him.
And when you zoom out, the impact of this approach is just huge. Data shows that the traditional path to becoming a confident, independent practitioner takes 3 to 5 years. With this kind of AI-assisted mentorship, that timeline gets slashed to just 18 to 24 months. They are literally cutting the time it takes to become an expert in half. That is revolutionary.
And this is where it all comes full circle.
Because this kind of powerful knowledge, it doesn't just stop with one person. It creates a cycle.
So now we see Marcus, no longer the nervous student, but the confident vet. And what's he doing? He's teaching a new graduate, Dr. Park, using the exact same tool. And her reaction says it all. This is like having 3 professors explaining every case. The apprentice has become the master, and now he's training the next apprentice.
So let's just be really clear about what we're talking about here. This is AI-driven mentorship. And it's not about creating dependency on a tool. It's the exact opposite. It's a continuous educational cycle that uses real-world problems to teach the core principles of expert thinking, which ultimately builds true, lasting independence.
Which leaves us with a final, really big thought. This story started with one vet student, but just imagine this model applied everywhere. To doctors, engineers, lawyers, programmers. What could we all achieve if every single professional had a tireless, expert mentor right in their pocket, guiding them not just to the right answers, but to a deeper, more confident way of thinking?